Prestige Orthopedics and Sports Medicine. I am the founder, Dr. Ron Noy. I do orthopedic surgery primarily on the knee and the shoulder, and in specific, ACL and meniscus surgery in the knee, which is arthroscopic, and labrum and rotator cuff in the shoulder, which is also arthroscopic. Arthroscopy means that the surgery is done through tiny incisions with cameras and specialized equipment so we can work within the joint without making large incisions. This dramatically can help the recovery process much quicker. At Prestige Orthopedics and Sports Medicine, we have specialized in trying to get people back quicker and faster to work and to sports with less pain. Part of the reason is we use arthroscopy with these cutting-edge techniques to get you back quicker. The surgeries that I do are outpatient surgeries, meaning you come in and go home the same day. We learn to control pain by controlling swelling. We use specialized techniques during the surgery, but also after the surgery to minimize the things that cause pain before you have it. Most of our patients don't use narcotics after surgery, and we are able to manage the pain with things like Tylenol Extra Strength and Aleve, as long as there's no medical contraindications to you using those medications. We also use cold machines to put cold therapy onto the knee or the shoulder to prevent the pain and the swelling. There are other videos that we can show you that talk about exactly what we do after surgery if you have surgery. By focusing on just a few operations, I feel that you can be better at those operations than if you did many operations. The example I always give everybody is Michael Jordan was arguably one of the greatest basketball players of all time, but when he tried to go play baseball as an adult, he was not the greatest baseball player of all time. Had he concentrated on baseball from the time he was 4 and not played basketball, odds are he would have been a very good ball player and could have maybe have been the greatest baseball player of all time. You can't be the greatest at everything. You can be the greatest at a few things. Therefore, we concentrate, as part of my practice, on the ACL and meniscus in the knee and the labrum and rotator cuff in the shoulder. The labrum is the ring of cartilage around the socket. It deepens the socket, but also helps stabilize the joint. If you dislocate your shoulder, you often will tear the labrum in the front. That needs to be reconstructed so the shoulder doesn't dislocate. If you tear your rotator cuff, it doesn't always mean you need surgery. If surgery is necessary for your shoulder or your knee, we will go through these post-operative instructions very carefully and very thoroughly so that you understand what you need to do when you're home to make your recovery painless and quicker. One of the most common knee operations we do is ACL reconstruction. These are very common injuries now, especially with sports such as soccer, skiing, basketball, football, anything where you plant and twist. If the ACL is torn, it needs to be reconstructed. When the ACL tears, it gets stretched out, so you can't just repair it back together. By reconstructing the ACL, the normal mechanics of the knee can be achieved. Without an ACL in the knee, the natural history of the knee is for it to become arthritic because of all the micromotion and the instability, and the knee just deteriorates over time. So even if you're not an athlete, ACLs should be reconstructed to prevent the knee arthritis. If you are a high-level athlete, it is very hard to get back to full playing potential without the ACL being reconstructed. Our techniques now are in such a way that patients often will go back to work 1 week post-op, often without crutches, without a limp, and most of our patients' coworkers don't even realize that they had surgery because they don't look like they did. If a meniscus is torn, it doesn't necessarily mean that it needs to be repaired or partially resected. If the symptoms in the knee correlate with repeated swelling, buckling, locking, then more often than not, the meniscus surgery is necessary. But if a patient does not have symptoms, there's no swelling, there's no buckling, there's no pain with impact, there's no locking, oftentimes you can try to forego the surgery until those symptoms occur. At Prestige Orthopedics and Sports Medicine, everyone here is on a team approach to make you as comfortable as possible and to get you back to where you feel you need to be. Staff will bend over backwards to make your visit as pleasant as possible as it can be after you have an injury. I try to only see 2 patients an hour in order to give you plenty of time for a full history examination and time for questions. We try to make sure that you always know what your diagnosis is when you leave, what the options are, and how you can get better with or without surgery as best as possible. We try to look at the big picture for you, not just the diagnosis. We don't treat the MRI scan. We treat everything about you, your symptoms, what's going on in your life, what's best for you. Can surgery be delayed 3 months if it's necessary? We look at everything to give you the best possible outcomes at the right time for you.